Remember how revolutionary LASIK surgery seemed just a few years ago? Now, millions of Americans have had the refractive surgery. And Dr. Yannis Kolettis from Illinois Eye Center joins us tonight in Your Health Matters to talk about whether LASIK is right for you. Thanks for coming in tonight.
Thank you for having me.
Take us through the process. Somebody comes into your office and says, I really want to get LASIK. How do you determine whether or not they're going to be a candidate?
Obviously, to try to make sure that you have good outcomes, you want to have good candidates. So what we like to do is start with getting somebody into a dedicated appointment, give them a thorough evaluation, make sure that the criteria that we look for, which are pretty extensive, allow them to qualify for something that will, get them to their end point. We have a coordinator who's dedicated to informing patients, educating patients, helping keep communication with them. We have very skilled and tenured technicians that can work with the patients and deal with their specific situations. And we also have a lot of technology that's used to help with diagnostics and screening processes so that we know that the person that we're dealing with future is going to be a good candidate.
Obviously, with people out there trying to make the decision whether or not they should get LASIK, a lot of things are going through their head. Most of the time, I would imagine what it is I really would love to just have my sight be perfect or near perfect all the time. The other fear, though, is that, is it going to hurt? Is it not going to take?
Right.
And things like that. How do you help people get through that?
Those are very understandable concerns. People come with certain misconceptions. We try to educate folks to get them sort of into the clear as to what LASIK can do for them. It is a painless procedure. We've got thousands of patients who can testify to that. It is a procedure that 97 times out of 100 only requires you to visit me one time in the laser suite, so it's rather predictable. We think that the way that we do things in our process will make the experience very pleasurable and make people want to tell others to come and do the same.
Real quick, we only have about 30 seconds left. What are conditions that probably mean you're not going to be a candidate?
We obviously want people to be of general good health. We want them to have a relatively stable correction, something that's not hopping all over the map for the last 6 months or so.
Right.
We want them to be of age, at least 18, and we want them to be motivated. If they have an underlying health problem, perhaps, certain things that we'll screen for during the question-answer phase and during the preoperative evaluation, we'll make sure that that's conveyed so that we don't do somebody inappropriately.
Okay. Pretty good examination given just right here. If you want to find out more, go to our website and Your Health Matters. Dr. Kolettis, thank you.
Thank you for having me.